CMRT Practice Test 2026 Certified Medical Records Technician Exam Questions and Prep. Question 1. Which law protects the privacy of patient health information in the United States? HIPAA, FERPA, OSHA, FMLA. HIPAA, Health Insurance Portability and Accountability Act, established national standards for the protection of health information. Question 2. What does EHR stand for in medical records? Electronic health record, emergency health response, everyday health record, extended hospital registry. EHR is the digital version of a patient's paper chart. Question 3. Who owns the physical medical record, the paper or the digital file? The patient, the healthcare provider/facility, the insurance company, the government. The provider or facility that created the record owns the physical/digital file, though patients have the right to access the information. Question 4. What is the standard timeframe for responding to a patient's request for records under HIPAA? 24 hours, 7 days, 30 days, 60 days. Under HIPAA, covered entities must respond to a request for access within 30 days. Question 5. What is the process of removing identifying information from a medical record called? Encryption, de-identification, redaction, purging. De-identification involves removing 18 specific identifiers to make the data no longer protected health information, FI. Question 6. What is the term for a medical record that is organized by the entity that provided the treatment? Problem-oriented record, source-oriented record, patient-centered record, integrated record. Source-oriented records are organized by the department or provider, example lab, nursing, physician. Question 7. Which part of a SOAP note contains the patient's description of their symptoms? Subjective, objective, assessment, plan. Subjective contains information provided by the patient or family. Question 8. What is a living will an example of? Medical history, informed consent, advance directive, discharge summary. Advance directives like living wills outline a patient's wishes for medical treatment if they become incapacitated. Question 9. Which code set is used to report diagnoses in all healthcare settings? CPT, HCPCS, ICD-10-CM, ICD-10-PCS. ICD-10-CM is used for diagnosis coding in the U.S. Question 10. What does PHI stand for in healthcare? Private health insurance, personal health index, protected health information, public health initiative. PHI is any information about health status, provision of health care, or payment for health care that can be linked to an individual. Question 11. In an EHR, what is the purpose of an audit trail? To track financial transactions, to record who accessed the record and when, to list the patient's allergies, to provide medical coding suggestions. Audit trails monitor access and changes to the electronic record for security and compliance. Question 12. Which document must a patient sign before their records can be shared with a third party for non-treatment purposes? Release of information, ROI, authorization, informed consent form, patient's bill of rights, notice of privacy practices. And ROI authorization is required for sharing PHI outside of treatment, payment, or healthcare operations, TPO. Question 13. What is the term for the length of time a facility must keep a medical record? Storage life, retention period, shelf life, statute of limitations. Retention periods are governed by state law and federal regulations. Question 14. Which organization provides the Registered Health Information Technician, RHIT, credential, AAPC, AHIMA, AMA, CMS. AHIMA, American Health Information Management Association, provides the RHIT certification. Question 15. What is the first step in the revenue cycle management process? Billing the insurance, patient registration/scheduling, medical coding, denial management. The cycle starts with gathering patient information during registration and scheduling. Question 16. What is a Notice of Privacy Practices, NPP? A bill for medical services. A document explaining how a provider uses and shares PHI. A request for a second opinion. A medical history form. The NPP tells patients how their PHI is protected and used by the facility. Question 17. When correcting an entry in a paper medical record, what is the correct procedure? Use whiteout to cover the error. Scribble over the error until it is unreadable. Draw a single line through the error, initial, and date it. Discard the page and start over. The original entry must remain legible. A single line is used to indicate the error. Question 18. What does the abbreviation HPI stand for in a medical history? Health provider information. History of present illness. Hospital patient ID. Human pathogen infection. HPI describes the development of the patient's current symptoms. Question 19. What is the purpose of informed consent? To guarantee a cure. To ensure the patient understands the risks and benefits of a procedure. To waive the provider's liability. To collect payment upfront. Informed consent ensures the patient makes an educated decision about their care. Question 20. Which of the following is considered a covered entity under HIPAA? A health insurance company. A patient's employer, in most cases. A gym. A life insurance company. Covered entities include health plans, healthcare clearinghouses, and healthcare providers who transmit health information electronically.